Sarah Smith. I'm Johnson Anthony. I'm one of the medics in the mental health team.
Hello.
Hello. Um, is it okay if I call you by your first name?
Yeah, that's fine.
Yes. Yes, Sarah. I understand that you think you might be pregnant.
Yeah. I've been feeling sick in the morning and also having that bloated feeling in my tummy.
Okay.
Yeah, I might be pregnant.
Okay. Well, congratulations. And
Thank you.
yes. So, how? How do you think I can help you today?
Well, I'm very worried now. I'm pregnant because I'm on methadone.
Mm-hmm.
So that's why I'm here to talk to you. Yeah.
Okay. Tell me a little bit more about methadone. How much you're on?
I can't exactly remember
Mm-hmm.
how much I'm on.
Mm-hmm.
It's about, I think, 50 mils.
Okay.
And I usually go to the pharmacy
Mm-hmm.
to have my prescription.
Mm-hmm.
Yeah.
So 50 ml, and you've been. How often do you collect the prescription from the pharmacy?
Well, every 5 days.
Every 5 days. Okay. And how long you been on methadone?
I've been on methadone now for nearly about 6 months.
6 months. Same dose, 50 ml.
Started off slightly low, but that wasn't effective.
Mm-hmm.
So yeah, 50 it does help me. Yeah.
50.
Well, not really. I don't think 50 is helping either, but yeah.
It's kind of manageable.
Yeah.
So my understanding is that you've been taking them regularly.
Yeah, I've been
You haven't missed any dose.
No, I haven't missed any dose.
Yes, okay. Any side effects from methadone?
I don't think so.
Okay. Yes, and the reason I get you on methadone is because you've been using heroin in the past.
Yeah, that's right.
Yes. Any recent usage of any other street drugs?
Well, it's good that you asked me because I'm still using heroin on top of methadone.
Oh
because
dear.
as I said, it's not helping me that much. Yeah, and then I use cocaine as well.
Cocaine. And so heroin and cocaine. That's a bit of a concern. But we'll see how we could help you with this. So with heroin, how much are you? I mean, tell me a little bit more about it.
I don't use every day.
Yes.
I use at least maybe about twice a week.
Mm-hmm.
And I use about 5 mils.
5 heroin.
5 mils of heroin, yeah.
Okay. So you use every.
Well, I said twice a week.
Twice a week. Sorry, I didn't get that. Okay. So twice a week, 5 ml heroin. I mean, how do you use it? I mean, how do you take it?
Inject it.
You inject it. Okay. And where do you inject them?
Well, wherever I find a good vein, on my elbows or on my groins.
Oh dear, that's a bit of a high risk, isn't it?
It is, yeah. So I'm quite concerned now. I'm pregnant. So baby's going to get affected.
I can understand. I mean, it is a very valid concern about the being pregnant and injecting due to the risk of infection and other things. So, when was the last time you injected?
Last week.
Last week.
This week, yeah.
And since okay, any infections recently? No. Have you been admitted or seen a GP?
In the past, I've been admitted with an abscess.
Abscess.
Yeah. This was a couple of years ago, but I've been okay since then.
And where do you take? I mean, do you take the heroin alone or with someone else?
Alone.
Alone.
Yeah.
Where do you take?
At home.
At home, alone. I mean, so how about the needle needles and syringes. Do you use clean needles and syringes?
I do.
You do.
Yeah.
So do you go and collect them from a local service?
From a local,
Yes.
yeah.
And so you use them at home, yes. You inject them. Okay. And any accidental overdose
No,
of
I don't
heroin?
think so.
You had it? No.
No.
Okay. Anyone else at home?
Yeah.
Yeah.
I have another child.
How old
I have a partner.
You got a partner and a child. How old is the child?
Child is 6 years old.
6 years old. I mean, any kind of incidents at home, like the child.
Everything's, I do everything very safely.
Okay.
I've been advised on the procedures that I should do, needles and all, kept quite safely in a cupboard. And I know what to do, but I'm still worried.
You're worried, okay.
Yeah.
So you mentioned you've been taking on top of methadone, heroin, and also cocaine.
That's
Yes.
right.
How often do you take cocaine?
Cocaine, again, it's about twice a week.
What's the amount?
It's very little, I can't say.
How do you take it?
Again, I snort it.
You snort it
Yeah.
through. Okay. And this has been ongoing for the last 6 months, same?
Heroin was, again, about an year, so that's why I started on methadone to help with heroin 6 months ago. And cocaine, again, about last 8 to 1 year or so.
8 to 1 year.
Yeah.
So before, when was the first time you started to use street drugs?
The first time was when I was 16.
16. Do you know what did you use at that time?
It was heroin.
Heroin.
Yeah.
And do you think, it has got better or it has got worse, the use of heroin?
It's got slightly better since I started methadone.
Okay. All right, that's good. Good. And just going back a little bit about heroin injecting, have you been any investigation done for any blood-borne viruses like Hep C, Hep B, and HIV?
Yeah, I've had. They all come back as negative.
Negative. Okay. So you're on methadone. You're taking on top of it. You're using cocaine and heroin. And so you mentioned about your family. What do you do for a living?
Well, I'm just at home. My partner works.
Your partner works.
Yeah.
Any stress? Anything at home? Anything?
Apart from financial stresses, other than that,
Have you any past history of depression or anxiety?
No.
Okay. So and on top of all this, do you drink alcohol?
No, I don't drink alcohol.
How about smoking?
Just a couple of cigarettes a day.
Just to clarify, do you take any other street drugs? No. Okay. So, with all this being pregnant, how is your mood generally?
I just get through the day. I think I feel okay, but this is the real concern now that I'm pregnant. So it has started affecting my mood now, but I think I'm coping with it.
Okay. So you mentioned you're concerned. So, which is a valid concern. What do you think the way forward?
Well, that's why I'm here to ask you, doctor. What do you suggest?
Okay. So, what we would normally suggest is that there are a few options that we could discuss. Yes. And one of the options is to stay on methadone. Yes. To continue until you see through until the pregnancy, yes, and given the fact you are using on top of it, what we would recommend is to increase the dose of methadone, because it's a very high risk to you and also to your child, and as far the infection is concerned. So what I would do is I would. Is it okay if you could go and you are seen by the
Drug
alcohol,
and
drug and
services.
alcohol team.
Yeah.
I would write a letter to them about our discussion today
Okay.
and about the plan.